Not only do I think that governance boards can make a sustained impact on quality and safety of patient care, I think governance boards are essential to make that impact. In a hospital or a health organization, the board is the ultimate accountability. Now, in my journey, it was when I had my first CEO evaluation, and the board of the Ottawa Hospital takes its evaluation of its CEO and its chief of staff very seriously. So I remember the first evaluation where the board committee asked me, the first question was, does this hospital provide quality patient care? And my answer, like any CEO or any VP Medical Affairs or any doctor, would say, of course we do. The second question was, how do we know we do? And there was a long pause, and my answer was, because we know. We are all committed to doing the best for our patients. And we've learned over time that everybody comes to work in a hospital wanting to do the best for their patients. Sadly, we've also learned that it doesn't always work out that way. So I think a board that asks the question, do we give quality of care, is important. But the board who asks the second question, how do we know, changes the whole dynamic and the whole culture around focus on quality of patient care. I think the next big thing that the board did was ask me to provide them with a quality plan. And I'll never forget when I submitted my first one, the board chair at the time read it, gave it back to me and said, Jack, this is a primer on quality and process at best. This is not a plan. And I remember going back to the senior management team and saying, the board wants a plan, this is not a plan. What we put together then was a plan that included tactics for improvement, timelines, investments, performance measures, and targets and expected outcomes. And under each of those 5 quadrants, suddenly it started to materialize what truly was meant by quality in a very concrete way. The board was visionary and very much leading edge on this aspect of hospitals. My sense was that up until this time, and for whatever reasons, the boards were quite comfortable with the assurances of the chief executive officer and the assurances of the chief of staff, the chief of medical staff, and perhaps the chief nursing executive, assuring them that their quality care was being given in their organization, and didn't feel comfortable or qualified to challenge that. So I think the question that this board posed has been rarely posed by boards is, how do we know we're giving quality care? I heard so many times, you know, don't cross the line between governance and management. In my mind, there is no line. It's probably as wide as a broom sweep. And the board occasionally dips down into management, and management sometimes dips up, and it's a back and forth. But as long as the board and the CEO understand that it's not a clear-cut line, understand that the dipping is in the best interest of the organization and brings value, you shouldn't get all caught up in whether it's a board responsibility or a management responsibility. We are all in this together. And so my board was very focused on quality and not losing their being fired. I was very focused on trying to improve the quality, and I don't think we got caught up in whether it was a board or a management responsibility. We worked together. And it was very powerful in bringing the board and the team together, because when you work in that relationship, you're very candid, you're very forthcoming, and you're very trusting. And when you think of it, many boards are made up of very successful community business people, and they have a lot to offer. I had been a CEO a few months, and so I respected what they could bring. They did it in a very, very trusting way, and they were very focused on processes and outcomes. Something that, you know, hospitals are generally focused on processes. but the outcomes are expected. This board wanted to see the objective outcomes in a plan. And I think that's where the difference was, and it pushed us to be even better. The number one thing that I believe moved the yardsticks was my ability to say to the senior management team that this is important for the board is asking for a plan, and they're going to monitor our progress. Bringing in the board to get something done is a huge leverage that any CEO can use to motivate a management team. I mean, if you think about it, the board has only two employees, the CEO and the Chief of Medical Staff. Those are the only two direct reports to the Board of Governors. And what they bring is the overall health of the organization, particularly with the medical staff, the quality of care. So the structure is designed to focus on the operations and quality because of the two employees that the board has. The relationship with the chief of staff has to be completely integrated, because if you recall, one of the key factors in our quality framework is efficiency and use of resources, and you can't pretend to use clinical resources in an efficient way if the medical staff is going in a different direction. So it's a very important relationship. I will assure you that you won't find a board member, a senior manager, or a medical leader who will tell you that we're exactly where we want to be in terms of quality of care. We've come a long way, but we've got a lot longer way to go. We're now going to overlay service excellence, physician leadership and engagement, and performance management to enhance the patient experience. And the vision that we're now aspiring to have based on that is the Ottawa Hospital will provide each patient with the world-class care, exceptional service and compassion that any of us would want for our loved ones. Now, if and when we reach that vision, how great would it be to be the CEO of that place, or even just to work in that place? That's where we aspire to be.